Welcome to the Health Optimization Medicine Podcast. My name is Dr. Scott Sherr. It is great to be with you all today. Excited to bring you a fantastic episode with JJ Virgin. JJ has been a friend, actually a recent friend, but I've known her for a long time in the health and wellness space. She is a stalwart here, and it's so excited to have her on our podcast. Here's a quick bio on JJ. She is a triple boarded certified nutrition expert, fitness hall of famer, and a passionate advocate for healing power of food and exercise. She's on a mission to redefine aging, not as something we endure, but as a stage of life to own with strength, vitality, and purpose. I love that. She's a 4-time New York Times bestselling author, multiple books, very, very, very successful there. She's also the founder of Health Business Growth Collective, formerly known as Mindshare, the most influential community of health entrepreneurs in the world. Her leadership has helped launch more New York Times bestsellers, PBS specials, and 7-figure brands than any other group in the industry. She's fantastic here. She's been on multiple media appearances. She also has her own podcast called the Well Beyond 40 podcast, which has surpassed 22 million downloads. And her social media content reaches millions and millions and millions. She is a fantastic human being, and I really had a great time having her on the podcast today. Her angle in our discussion today was super interesting. We talked about this new framework that she's developed that she calls, she has a triangle framework called, and she has 3 aspects to the triangle. One is vulnerability, the second is authority, and the third is proof, with you in the middle. And she goes through all the steps of really trying to create you as a clinician, your brand, and understanding how you're going to create something so that people want to come see you, patients want to come see you. How do you create an audience? How do you create your mission? And JJ's really nailed this because she's been doing it for such a long time. She knows that we all need a platform to be able to create something. But it feels difficult as physicians and clinicians and practitioners to do this. We feel like there's a lot of competition out there. We feel like, how do we make ourselves different from everybody else? And so what JJ does in this podcast very, very well is to give you a roadmap, to give you understanding of what the real tools are within her framework to be able to do this and to get out of your own way. That's the hard part as clinicians, that most of us, we have an issue. We have an imposter syndrome. And I definitely feel this personally with my own practice over the years. When I started things out of the hospital as an internal medicine physician, it was a different animal altogether, and I didn't feel comfortable. And so I really hope you enjoy this podcast with JJ Virgin. If you do, don't forget to like and subscribe below so you never miss an episode. Enjoy. JJ, it's so nice to see you.
You too.
Thanks so much.
It's been a while. What,
I know.
like a week?
I know, just a couple of days. I feel like I was just in Tampa interviewing with you, and it was such a great time to be with you and Tim. And thank you so much for the platform to speak about some of the things that I do. And I'm so excited to have you on our podcast and talk about all the things, not all the things, but some of the things that you're really excited about right now. Because I know, like you, we're always on to the next thing, always trying to figure out how we can make our models better, always try to help the people that are in our ecosystems work better, do better, feel better. And you were just mentioning before we started recording that you had just over the last couple of weeks, with AI and personal branding and how to really understand this as a clinician and become unique. And I think all of us in the clinical world are really just trying to understand this now with the advent of AI and how it can help us, but also it can be potentially challenging as well. So maybe run me through what this new model is or how you're kind of bringing this together, and we can talk about it in detail.
And this is my left brain math enthusiasm you're about to get.
I love it.
It comes from this whole thing with AI. Yes, there's a lot of fear involved, but I always look at what are the possibilities? And here's what we know to be true right now in the world of AI and the post-pandemic world. We're in a recession, but not the recession people think we're in. We're in a trust recession. And one of the groups that's really suffering from trust is the healthcare professional, right?
Absolutely, yeah.
And so once we know this, we need to do something about it. So what I've been really looking at is I work a lot with practitioners who are in the longevity, hormones, health optimization, regenerative medicine, like all that space. Mm-hmm. And one of the big fears they have is, it's saturated. I'm always like, it's not saturated. You don't need to worry about that. But they have the fear it's saturated. I know the big questions that always come up are, how do I get more patients, right? And how do I do a cash-based business? All of that. And I realized that there's a really key foundational piece that once you have this foundational piece, it makes everything else easy. When you really look at personal brand, and here's the reality, that trust recession, Forbes just did a study and they found that 82% of people are going, and this is going to be a little bit, make you throw up a little in your mouth. So here we go. 82% of people are going to social media before they make a buying decision to see if the person is real. Now, that conjures up, I know, kind of fear in every practitioner's heart that I went to school, so I'm going to dance and point on social media. No, that is not the case. However, you do have to show up on social media, but not as an influencer. There's a different position, and it's something we started using in the Health Business Growth Collective years ago, but I feel like I finally put it all together in the last couple of weeks. So this is why I'm so super excited about it.
Yeah.
So it is the difference between being an influencer versus an authority, but not just an authority, a trusted authority because of what's going on now. And so what I've been putting together is, how do you create this trusted authority, this category of one, this person who stands out, not because you're better, because everyone will say in marketing, I'm better. That's ridiculous. Like, no one knows better quality, better. That's what everybody always says. So what Sally Hogshead, who wrote Fascinate, says is, it's not about being better, it's about being different. It's about that category of one, how you're unmistakable, how you're irreplaceable. And so that's what I've been working on this framework of, and I've created, which I'm going to share with you today, that everyone can just go and take to create their own category of one in whatever niche that they're in. Because one of the first things we always teach that we get a lot of kickback from is that you've got to pick a lane. And everyone's like, but I treat everything. I go, I know you do. I know. But you know what you do is, if you pick the lane, you'll still end up treating all the things. But people seek out experts. And especially now with SEO and AEO, people would never type in, I have a general health problem. So they're never going to find you unless you put your stake in the ground and you have, stand for something. So when you look at this trusted authority triangle, and I can actually give you this so you can do a download picture of it. The bottom of the triangle is trust, because attention without trust is meaningless. So you see a lot of virality online, and they're doing ridiculous things. And I'll tell you this funniest story. We hired this YouTube guy to help us with our YouTube channel. And he goes, started show my team other channels we could model with girls in like skimpy workout wear. I go, you do know I'm like 62 and I'm like, my days of wearing booty shorts and a jog bra, like that's so not happening. Like, this is not how I want to get attention. Thank you. You've missed the plot, dude. You're fine. So, so we know that you've got to have that trust. But here's what's crazy. When you ask, and I just did this recently, sat in a room of healthcare professionals. I go, so how do you create trust? And it was like, okay, patient results and your credentials. And it's like, nope, not how. Do you have an idea of how you create trust?
I would say, like, for me, as you were saying it, is that there's a couple different ways you can think about it, right? So when I think of creating trust, I think of bedside manner being a big part of it. So if you're actually communicating with people in person, it's much easier to create trust. But what you're kind of alluding to is that it's much harder when you're trying to bring them in and create something and to create that trust without actually seeing them in person. What is that otherwise, right?
So there's actually, it's not any of those things.
Yeah.
And that's what everyone did, because think about your lens. You're coming in from the doctor lens. So you're just like, okay, it's my bedside manner. Okay, it's my credentials. Okay, it's actually the thing you were taught never to do in medical school. And this is the problem. It's your humanity. It's your vulnerability. It's your relatability. The things you're not supposed to show.
Of course.
Those things.
Yes. Yep.
And what's so interesting in the world of integrative, functional, alternative, whatever the heck you want to call it, is it is rare to meet someone in this world who isn't here because of a personal story.
Sure.
And that personal story is the vulnerability, is the relatability, is the humanity. So it is the reason that you want to let people hear your story, not in the TMI sense, right?
Right. It's the version that's meant for TV kind of version.
It's just for them go, oh, this person's like me.
They're human. Right.
It is, get off the pedestal, take off your white coat, take off the stethoscope. If I see one more picture of someone with a white coat and stethoscope, stop that. That's the 80s. Knock it off, right? It is the come down and you're going to talk to them, because that's how they will trust you, if they can really feel you, see you. So that's the first part, is that trust.
The trust comes from vulnerability, basically.
It comes from vulnerability.
And then and you can demonstrate that in any kind of, and so when you're talking about being an influencer versus being a trusted authority, that's the first aspect of it, right? Is like you have to create this vulnerability. So it's interesting because like what I find is that, as you said, JJ, most of the clinicians that are in the worlds of practice that you described, that you're most aligned with or you work with, they're all coming from a place, most of them are coming from a place where they have their own personal story, right? How they got there, or a family member that was failed by the system, which is, I think what you're kind of really digging into is like, how did you come by and, become the person you are, right? So,
right.
Yeah.
And we all have some kind of story in there. Quite often you don't realize you have it because you can't see the picture when you're in the frame. But as you start to become more aware of it and talk to people, you realize, or a friend will dig it out of you because they know you, right? But that is that key piece. And one of the recommendations this past weekend is if you're struggling with this piece, read Brene Brown's vulnerability book or watch her TED Talk. Because she really was the person who put this on the map. So that's the foundational part. Now, on the left part of the triangle, I have authority.
Okay.
And this is a really interesting piece because, again, when you say, okay, well, what creates authority? What would you think?
Well, of course, you'd think that you have a command of something, a command of a topic, a command of a ecosystem in some way that you really understand a lot about, so that you can come from a place where you know more than everybody else, kind of deal, right? Or at least have the capacity to have a different angle on something that's maybe something that people know a lot about.
Okay, you just said something very important. You said a different angle. And I'm going to give you an example since we were just talking about our buddy, Dr. David Perlmutter. So David, he's one of the sweetest, kindest human beings ever and the least contrarian human you'll ever meet. And yet, David Perlmutter doubles down on the fact that what you eat affects your brain and writes the book Grain Brain. Gets pummeled. Critics, you're a quack, you're crazy. But it's the hill he would die on. It's his contrarian belief. He's going to go for it.
Right.
And he's seen as this massive authority. So the way you create authority is through these different ideas, these contrarian beliefs. You look at what everybody is doing in the world of hormone replacement therapy. Everyone's saying, oh, you can only be on 10 years. You're showing how they can use it the rest of their life. Oh, right. If you didn't start it within 5 years, you can't do it. Oh, you're showing someone how to start it when they're 5 or 10 years postmenopausal. So what is the sacred cow in your industry? What is it? A piece of health advice your patients walk in and say to you and you're like, that again? What are those things that you feel like you're just continue to say? For me, it's like, no, you're not going to get bulky lifting weights. No, you should lift weights before you lose the weight, not wait to lose weight to lift the weights. Right? Yeah. I literally was taught in grad school, do not lift weights till you lose the weight. I go, that is the dumbest thing ever. So, what are those things that you hear all the time that you would put a stake in the ground on? It's a hill you would die on. Yeah. And what's important in our world, like if you go online, you will see these authorities that people will follow, people are throwing money at, saying ridiculous stuff, but with conviction.
That's all you need sometimes on social media. It
drives me crazy, right? Any health expert out there is looking at someone out there saying that methylation is the root of all health problems and ready to just, bang their head against the wall. But yet that person has massive reach and massive audiences and people follow them because of the absolutes, because of the authority. And so it is our responsibility in the authority part, because we know that absolutes and accuracy don't necessarily live on the same street.
Never.
But in our world, they have, if I'm going to say that you should lift weights before you start to try to lose weight, I better be able to back up why I'm saying that, right? Right. If I'm going to say that creatine HCl is a way better form than creatine monohydrate, I better be able to say why. So you can't just pull stuff out. You have to take this authority stance, but with integrity, right? With the accuracy.
And that's the hard part though, right? Yeah. So it's like, how do you dance in the world? Like, I 100% agree with you, because this is what I think about all the time. I think about as a clinician, we all think about, a lot of us, over and over again, you're getting the same questions asked. You're answering it in similar ways. You're seeing the same issues. You see changes in how people make major gains when you ask them to do certain things. That's true. But navigating this as a consumer is so interesting, right? As you said, but I think we can keep that aside for now, right? Because I think that's not really what you're driving at. Really the drive here, as I understand, is what's your authority for a very specific niche, and not it doesn't have to be small, but a place where you can really put your flag in the ground and say, this is what I believe, right?
Confidently, I believe in this, because here's the challenge you'll hear out there. It's nuanced. It depends. It's like someone will say, what's the best workout for me? I'm like, well, it depends. It's nuanced, but so you have to think, what could you confidently say that you can feel good about, yes, there's always going to be the outlier, but it's the rare thing, right? So, what would be the thing? Because again, that's what people grab onto.
I understand. Yeah. The nuance is everything. And that's big. It's a big challenge, because you see patients for a living, that's what you live in, right? But I understand it. I mean, just like when I was on your podcast talking about the sympathetic spiral of doom, it's this pattern that I've recognized, and that clinicians already know about it, but now it's a pattern that we could potentially put a name to and then understand how to address, right? So that's, I think, what you're driving at, right? Like, have some sort of angle where it's like, it may not be new in some way, but it might be just a different color.
It's a different take on it, a different way to position it.
Yeah.
And, when you write a book, I always look at a book when I'm writing it and I go, can I get someone 80% of the way there? It's not going to get someone 100% of the way there.
Yeah.
That's called working one-on-one with someone.
Yes,
but
80%.
How far could I get them there, right? And so if I have this absolute, that food intolerance can be a cause of weight loss resistance, it can be everyone's cause of weight? No. But if you're the person looking for that has all of the symptoms, this could get you 80% of the way. Then we probably do some other things.
I'm with you.
So we've got trust on the bottom, then we have authority, but there's another part of the triangle, and then there's something in the middle. So, which is the most important. So on the other side of the triangle is the piece that they really can't copy. It's hard to copy your vulnerability, right? They'll likely try to start copying your contrarian statements. That's why I always say trademark them. There's the things I didn't know to trademark early in my career. I'm like, ugh. So now it's like trademark. But on the other side is your proof. Now, there's a couple ways to look at proof. And the example I gave yesterday, I think, is really a good one. And it was, for proof, I could say, hey, I am a 4 times New York Times bestselling author, and I've sold over 1 million books and or I could say, I had a gal who had psoriatic arthritis. She was put on some immunosuppressant drugs. She could no longer work at the elementary school that she loved. She couldn't even have her grandchildren over because she would get sick. So all the things that were important to her in her life, she was no longer able to do. And so one night, late at night, she Googled anti-inflammatory diet, and she found the Virgin diet, and she followed the Virgin diet. And within a matter of months, she was able to go off her drugs. She was able to halt the progress of the psoriatic arthritis. She was able to return to her elementary school, and she was able to play with her grandkids again. That's the proof that really matters. So you've got the proof over here. I've got 40 million downloads. Right? And you can, those are, but when you take a proof and you can tell the story of that patient, that's the proof that really, really matters. Now, here's what's important about proof, especially in the world of AI. The funny thing is, in AI is looking at proof because then it says you're real, right? So those stories are more important than ever. But the other reason those stories are so important is because if you say this, if I say, I'm a 4 times New York Times bestselling author, a lot of people are listening going, I don't like her. Or they're thinking, sure, it's easy for her for whatever reason. I literally, Scott, had someone say, oh, well, it's easy for you. You had that last name.
I love that.
I was like, really? Okay.
It's so interesting because you're really talking about looking at it from, do you go in from like a top-down approach, like, or do you come in from like a bottom-up where you're going from like a heady kind of place where like, I'm a New York Times bestselling author, I have all these books, I have all these podcasts, or is it I'm going to grab you from the heartstrings and grab you here emotionally to bring you in? I think that's what you're talking about as a difference there, right?
Yeah, I will tell you what I do. I do both, and I'm going to give you where I want to use this proof that's really going to be helpful for people. Let's say I'm going to go do a talk. I have a speaker intro reel, and the reason I have a speaker intro reel is because if you don't have a speaker intro reel, people will kind of free fall as they intro you. And I've literally had people introduce me as an aerobics instructor. I'm like, whoa, when I was in college. So, if you have a speaker reel, it's great. And then you walk out on stage as big you, right? The challenge is that does not make people love you. It makes people start to look and go, oh, she thinks she's all that.
Yeah. Especially females, I think. Females, I think as well.
Oh,
right? That's a big part of it, I think, as well, interestingly enough. Yeah.
You betcha. Yeah. Guys don't do that. Girls are like, yeah, look what she's wearing. I mean, it's like ridiculous. So the next thing you have to do is go to little me. You just had the big me, and I walked out. I don't remember. I just did this one. I go, you just saw the highlight reel. Let me tell you what really happened,
Mm-hmm.
And then I proceed to tell like the challenge, the hard part, where I felt like the vulnerability, because otherwise they're not going to listen to you. They're going to judge you. So you want to make sure that when you are showing these things, you've got to show that the vulnerability too. And the reason I really love these stories is you'll hear someone's heart. Like I think of David Perlmutter telling when he did his very first fecal transplant and why he did it and what happened with the family. And you just like fall in love with him.
Right.
But here's the other reason these stories work so well is people are looking at you and they're going to decide if they should work with you. Now, what we don't realize is how long that decision can take. It turns out that 50% of the people that may start to engage with you, maybe they get on your list or they start to follow you, 50% of those people will probably make a buying decision in the next 18 months, not necessarily with you, however, right? What you don't know is at what point are they ready? Are they right now just problem aware? Are they solution aware? Where are they in that journey? 3% generally are going to make that decision pretty quickly, 15% over the first 3 months, but most of them over the next 15 months, they're checking you out and they're looking around at other things. And if you're not actively showing them, what's going on and earning that trust and showing your authority, they're going to go somewhere else. The biggest question that they have for you is, we think it's, I don't have the time, I don't have the money. But the reality is, if people believe that it would work for them, they would find the time and the money. So the biggest question always is, will it work for me? Because people don't want to make a mistake. And quite often in our world, they've tried so many different things that by the time they get to you, their belief is really low. And what these stories can do is they can show them that it will work for them, that this person just like them was going through this and they got better and they can too. So that's where it really is helpful.
The 18 months, so you're saying it's usually about an 18-month period of time when somebody's looking for a practitioner. That's how long it can sometimes take. That's the cycle.
It can be. Okay. It can be. So this process, it's really interesting and it's been shown in all sorts of different industries.
Yeah, I wasn't aware of so long. Yeah.
I wasn't either. And and this is why I teach this, because for most of us, we're like, oh, they weren't interested.
Right. They're going to be gone. If they didn't make a decision in a month, they're not making it. Right. Yeah.
And so the reality is, and it really depends what's going on. I mean, if they just broke their leg, they're making their decision. Right. But, if they're thinking about some kind of elective surgery, some kind of health optimization, they're checking things out. They're sniffing around, they're watching things, and it may take time. And again, in the marketing landscape, it's going from like unaware to problem aware to solution aware to taking action. And we just don't know where they are in that process. And so that's why you've got to get people into your ecosystem, and then you need to continue to educate and nurture them so that when they're ready to say yes, you are top of mind, not someone else. That's what's really important. And again, I thought, when I first started to look at all this, I figured if they hadn't done something in 3 months, they weren't doing it. I know in our world in the Health Business Growth Collective, it can be longer than 18 months. They're just hanging out. They have to a lot of times people have to get into enough pain with their thing, right? They finally go, that's it. I'm going to do it. So,
yes. No, I understand.
Yes.
So interesting. I didn't realize that it was such a long period, but I think that's helpful for those that are listening, right? Because as practitioners, we just have to be able to do what we're doing on a regular basis and continuing to put out that ecosystem that we're looking to create, right? And then knowing that the right people will come our way. Because the other thing I always talk about to my practitioner colleagues as well is that it has to be a mutual relationship. It's not just these people want to see you. You want to be able to have to see them and enjoy that part of it as well. And that's a big thing that's also hard for clinicians because they think they need to take everybody sometimes too.
Oh no. Yeah. We get to choose who we work with. One of my favorite experiences early on in my career was firing a client. And I remember her going, she was paying me a lot of money. And she goes, you can't fire me. And I'm like, well, I just did, Sure I did.
Yeah.
So yes, I can.
Yeah.
So yeah, it's very liberating. I mean, I couldn't afford to fire her, but I couldn't afford not to.
I understand
either.
the type. Yeah.
So
super
important.
Well, just one thing that's funny there, Dr. Ted, who's one of our founders at our nonprofit, he likes to say that he cannot create a therapeutic relationship with the patient. That's how he says it to them. And he's happy to refer them to somebody else. And I like that as a line that I've used many times before. But I don't want to keep
we've all done it. We have
Yes.
all tried to help that person that, and we have a couple rules in our businesses. If we're setting up all the structure and rules and standards for one client, one patient, one employee, just get rid of that person. Right? Or if all of a sudden you realize, like in the 80-20, you're spending 80% of your time on that one person, just release that person. It's just not a right fit. They'll find a better fit elsewhere. It's not with you.
Oh, one question on proof before we get up. I know there's a middle of the triangle too that I'm interested in, but how do you kind of navigate with the nuance of what's real proof and what's made from some sort of AI proof, right? You can do your best, right? But you can have a lot of people go out there and create their own stories that don't even exist anymore, right? You see this with influencers, you see this with other people, but is your angle here, that doesn't matter. You just do your thing, create your unique proof with your unique situation and your unique practice.
Yeah. And here's the thing. So yes. And the more you have, like if you have stories and you tell the stories and the stories are seen in other places and you've got video and you've got it, there's going to be fake AI. It's going to be more and more and more of that. But that's why the in real life is more important than ever. And being able to see, a video of someone, then hear a story about someone. When someone's making something up, they don't tell it the same.
No, they don't typically.
It's not the same. So
Yeah.
I just can't worry about all that. I figure as the more we're doubling down on these three things,
Right.
yeah, I can't. It's going to be very hard to copy all that stuff. So
I understand. Yeah.
there
Okay, cool.
is. So in the middle, do you want to know
Yes.
what's in the middle?
I do.
Did you figure it out? Do you have an
Is
idea?
it the cream part of the Oreo? Probably not. Yeah.
It is not the cream part of the Oreo. What is that anyway? That stuff. in the
Nobody
middle?
knows. I think it's made from some sort of chemical factory that used to make
It's
gasoline
like
fuel or
hydrogenated
something.
fat of some sort, right? Isn't it some kind of sugar hydrogenated
Yeah,
fat?
it's hydrogenated something, hydrogenated vegetable oils or something like that. But
Yeah.
so, I mean,
Yikes.
I'm interested. What I can say that the most stable structure in the universe is a triangle, JJ. Actually, I don't know if you know that. And
No.
so I'm interested to see what's in the middle of it.
Well, here's what happened. So I had this triangle and, I think I told you, Tim and I were in Egypt and we were in the Great Pyramid and we
Yes.
were in the king's chamber and had this big epiphany. And so I'm looking at this triangle and I'm having this big epiphany. And I'm like, it's like the king's chamber where really it's you. You are in the middle of this.
I had a
And
feeling,
the reality is what I see over and over now, coaching thousands of practitioners, is the biggest constraint they have in their business is themselves. And generally, the biggest constraint they have in their business is something that they think is a constraint that I actually think is a sign. It's in a good sign. So I'll hear over and over again that they have imposter syndrome, right? Well, or, because when we go over to authority, well, I can't do that. I need to take all these patients. I can't niche down, not realizing they'll have more patients and they'll pay more. I can't share my story that, all these reasons, right? But in the middle of that is this, so I don't have to, and it's because I don't feel good enough. Who am I to do this? Blah, blah, blah. My feeling on all of that, and I think healthcare practitioners more than anybody else are more prey to this. And as evidenced by, I can tell when someone has imposter syndrome because they'll have like 50 different credentials after their name and they tell you they still need another one, right?
That's so good. I like that. That's a good direct correlation. I like that.
Yes, it's like, I was like, okay, when are you going to start your business? Well, I need another I'm like, no, you don't.
I love it.
So, But that you in the middle, what if imposter syndrome was really the sign that you were getting out of your comfort zone and playing a bigger game?
Right.
What if it's actually the best possible thing? What if we should look for, you know how you say, do one thing a day that scares you? Literally, I look for the things that shove me out of my comfort zone, that make me go, who am I to do that? Right? That's what I'm always looking for, is how to get into that space. I think we should seek it out because that's where all the growth is.
This is something that you teach, or how do you think about this? Because the hard thing for me, as I kind of, diffuse this into my awareness here, is that, like, you're totally right. Doctors are probably the worst at feeling like they're imposters, and then having them start breaching out of that comfort zone. Mm-hmm. What are some steps that you found have been really helpful for physicians and practitioners to be able to do that, aside from getting more letters out of the end of their name and things?
Yeah, the letters don't do a thing.
Yeah. I know you've worked with so many, and I have a lot of friends that you've worked with over the years that have great platforms. And I know one specifically, she's an introvert. She does not like doing the things, but she knows how to do it now. And she does it famously because of your platform. So,
God, I'm an introvert.
Yeah. Okay.
I'm an introvert and shy. So, and that's why someone said that this past weekend, well, I can't do that because I'm an introvert. I'm like, I'm an introvert. And I assume when I look out in a health audience that the majority of them are introverts.
Yeah. Mm-hmm.
It tends to be the personality type. So early on, when I was in grad school, and I went and moved in with a business coach. She was going to mentor me to help me be more successful. And she had me I remember I moved in, I literally dropped, I was at USC in a PhD program. I drop out, I move in with her. I'm going to learn how to be more successful. And she puts 2 rubber bands on my wrist, and I sold my business. So now I'm in this, and she puts 2 rubber bands on my wrist. And she says, okay, every time you have a negative thought or a limiting belief, snap your rubber band. So I'm thinking, I just dropped out of school and sold a business, and you're supposed to teach me how to be successful, and you put rubber bands on my wrist. And this is something we actually do in our mastermind, where we have people really, thoughts create. Your language is so important, and so much of the shift out of imposter syndrome is the words you say to yourself. That's why you are in the middle of the triangle. It's the language that you say to yourself. It's what you think, right? Thoughts create. That's going to make the biggest difference. So if you believe you're not ready yet, you're not ready yet.
Totally. If you believe it, it's true. Yeah.
Right. And so I just help people start to become very aware of this languaging. And because she trained me so well at 30 with this, I'm so aware of it now. I listen for it all the time. And I'm always like, and she taught me cancel. And so I'm so used to doing that with people. And that's what we will do in the mastermind. And what we teach in all of our programs is, if you start to do this, you will be aware of other people. You can help each other. Our whole thing is a rising tide lifts all boats. When you're around people who think bigger, who stretch themselves, who want to get out of their comfort zone, who are in that growth mindset, right? It's contagious. Mm-hmm. Just like it's contagious to be the other way in like the negative situation. So you create a situation where you're around other people who are all, going out there and trying things that would be scary, that they could fail at, et cetera, and supporting each other and realizing that as you're doing this, you can't course correct standing still, that you are going to make some mistakes along the way. You're not doing brain surgery. It's okay.
Mm-hmm.
That's the biggest thing to communicate, is like, it's okay to do a dumb social media post or flub a talk. You weren't doing surgery.
Right.
You were testing things out.
Right.
That's fine. You're not going to be amazing. I think one of the challenges with practitioners when I start with them is they're so competent in what they do that stepping out and being a learner again, a beginner again, is like, ugh. They think they should be right at the top of the pyramid of the thing. I'm like, you have to learn. Like, you're starting from the bottom here.
I have a funny story. When I was in 7th grade, I had a friend that was a compulsive liar. He lied about everything. And I remember I was in 7th grade, and I asked him, like, why do you lie about everything? And he said, well, if you believe it, it's true. And how precocious this individual was. He's actually quite successful these days. He's actually quite successful, actually, funny enough. And so
I know. So what's the dividing line? Was he just creating his own reality?
That's what he was doing, right? And what was so interesting, he's a brilliant guy, actually. And I remember how smart he was. And that's why I asked, I remember being in 7th grade, just like, why are you lying all the time? You don't have to, And but it's an interesting psychological experiment to see that it's what you believe that is actually true. Just like you said, if you don't think you can do it, then you can't do it, right? And I talk about this with my kids, and I'm sure you've done this with yours over the years. It's like, if you have the mentality that you're not going to be able to do something, well, shocking, much more difficult to do. Yeah.
No, when my son was hit and left for dead in the street, and they told us to let him die, I literally stood there holding onto a pinky, since everything else was in a cast, and he's in a coma. And I go, "You're going to be 110%." And his dad said, "We're going to prove every doctor wrong." And that's all I wouldn't even, if a little scary negative thought would jump into my head, because sometimes Friday nights in an ICU are very lonely and scary, and you're looking at a child in a coma who's staring off into space. And I'm like going, 110%, 100. And I would just keep looking for proof and looking for what's the next thing to do to just stay on that trajectory. And it's like, because I knew thoughts created, and I thought, if I'm just like trying to keep them alive, that's a very different outcome than like, let's get you to be better than before the accident.
Yeah. Yeah. It's such a beautiful, beautiful way of thinking about it, and it's not always going to work, but I think certainly, and I think having that mindset is going to work out more than it's going to have the opposite of mindset. And
so what if you fall short? I kept thinking, well, okay, so if I go 110%, which doesn't exist, and he falls short and he makes it to 70, it's not dead.
Right. Exactly. Yeah.
Yeah.
Well, JJ, I love this triangle. You talked about trust, authority, and proof, and then you being in the middle. I mean, it seems like something that you've been working on for a long time that you've finally been able to kind of put together,
just kind of came, the trust and the authority I've been working on, and then the proof, and then I was listening to, then we went to the triangle, the pyramid, and then I was listening to Simon Sinek, and he was talking about you, and I went, there it is. So it's just interesting when you're really in the middle of something, how it just all comes together. And I think one of the important things when we're really working on this, listen to Simon Sinek in the morning. It's amazing. Listen to Tony Robbins in the morning. Listen to, Joe Dispenza in the morning. Like, just get your day started correctly. Get a little frame. It only takes like 10 minutes while you're getting ready. Throw one of those in, and you will walk out like with big you going, right?
A final question for you regarding the triangle would be, where do people do this most effectively? In the sense of like, is it social media? Is it on their own newsletters? Is it going out in their communities and doing talks and things like that? Or is it, really depending on the person and what they're looking to do? Like, how do you feel like, given the world that we're in now and everything you know about how to brand yourself, what do you think is like the top, 3 things that people should be thinking about doing to be able to do this? In what kind of platforms, using your methods here, the framework?
So again, personal brand, we are not buying from faceless companies anymore. In this trust recession, we have to have a personal brand. So that's the first part. We actually created a 1-day workshop where you can come out with your brand. This trust and authority is the integral part of it. But then it's like, what's your messaging, right? What is your niche? What is your audience? What are their feelings? Like, there's a whole bunch to it so that you can take all of that. And that's how you design your programs, your signature talk, what you're going to talk about on social media. Because wherever you are, whether it's doing a talk, and I believe that we should all be speaking as much as possible, but what we want to do is have a clear through line signature talk. Now, I have my clear through line signature talk around muscle changing everything and, take a muscle first approach to health. I can do that for clinicians. I can do it for consumers. I could do it for a 50 plus audience. I could do it for a, 20 to 40 audience. I can change the wrapping paper.
Sure.
But the messaging is the same. So I'm not rewriting my talk every single time. And that's the same messaging that will show up on social media, so that when people come to me, they know what they're getting, and I'm drawing the people I want into my ecosystem. I'm not going to go out in left field and start talking about, something, I don't know what it would be, vegan diets or, fasting. I am talking very specifically on a very specific area, and that's what I stay in. So that's the first thing, is if you get really clear on that contrarian statement, through lines, all that stuff, that's going to permeate everything that you do, whether it's the social media stuff. So you'll have your clear posts that you do and that you talk about and the questions you answer. And so I think we all need to have one channel that we focus on.
Okay.
You don't have to focus on all of them, but I think you need to pick podcast YouTube. If I'm going to do YouTube, I do podcast too, because you just do your YouTube and put it on your podcast. But if I had to pick one and only one, I'd probably pick YouTube. Because it's a search engine, and a lot of what we do requires education. So it gives you the opportunity to educate. If you then can take those shorts, let's say you did a long form video on YouTube, maybe twice a month. And from that, you created some shorts. And then you took those shorts and at least had an Instagram presence, because I view that almost as a website.
Right. Okay.
And you can put a short a week. It doesn't matter, but just so that people see that you're real there, super important, because you can sell through your DMs on Instagram. We have people who are building their entire 7-figure plus business in the medical field through selling through DMs on Instagram, right?
Wow.
So
Okay.
it is
Yeah.
with a small Instagram. I think this person has maybe 10,000 now on Instagram. She started small. So there's that. So I say pick one of those platforms.
Okay.
Speak as much as possible. You have your hill you can die on in your niche in your area. It makes it very easy for you to collaborate with other people, because I think the most effective way to build your business is through referrals from like-minded practitioners who share your audience. That's the number one way I've always built my business. Always.
I love that. I think that's
it's a transfer of trust, right?
Exactly. That's exactly what it is. And that's what I was going to say, is like the collaboration aspect of things, finding people that are like-minded than you and have good reputations, or maybe they're building up their own too. It's like a great way to build that. I love that particular one. And I think you can see that both online as well as in your local communities, depending on where you are and what you're doing.
Yeah. Podcast swaps, Instagram. I'm doing Instagram Live right after this with Dr. Srini Pillay. So you can do all sorts of different swaps and lives, and it's more fun. You could do a little, meet up in talks. I used to do those all the time with local docs in my area in Palm Desert. So, and it's more fun. And, I've always been a big collaborator. I don't really see a competitive situation. And the reality is, someone who does something very similar to me, a person may resonate with me or they may not. And they may work better with the other person. Yeah. It's not like there's not enough people to go around.
I think that's actually an important, last point there, is that I think doctors do worry that they're in competition with other doctors sometimes, for what they're doing. And I think that's misguided for just the exact reason you just mentioned. Yeah.
There are more people than we could ever all handle. We do better all together. We collaborate together. And guess what? Everyone's social stock rises when we're together and hanging out. And I learned that early on, because people who were doing the things the most similar to me. I mean, I wrote a book that Mark Hyman, when he gave me the forward, he goes, "Oh, this is just like my book over here," and laughed about it, right? And I'd never read his other books, but it turned out that because we had similar books, hey, we shared audiences and they bought both our things,
That's great. Yeah.
Right.
Yeah.
So quite often people are collectors. They're going to go see a variety of people. They're going to go read a variety of books. They'll do different programs. They collect. They don't go to just one person anymore. Yeah. It's not like they're going to get knee surgery. They're going to do whatever. If they're doing health optimization, they may pop around to a couple different people.
That's amazing. JJ, thanks so much for spending some time with me and our audience here. Any final words or thoughts before we wrap up? And then also, of course, where we can find out more about you, your ecosystems, and anything else you'd like to let us know about today.
I just think it's a very cool time to be a practitioner. AI is giving us some amazing tools. Don't be afraid of it. Just realize that it also is giving you an opportunity to really lean into who you are. Again, this is now the time that personal brand is really standing out. So it's your opportunity now to stand out and, be seen and see other people. So take advantage of that. For where to find us, we rebranded. We used to be called Mindshare. We still have our Mindshare Summit, but we realized that what we really help people do is grow and scale their health businesses. So we became the Health Business Growth Collective. And that is at it's at hbgc.co. And we have a variety of really cool things that could be helpful. So what I'll do is I'll give you some of those, because we have our business ascension model. We have an AI tech guide. We have a bunch of really cool.
We'll put it in the show notes for sure. Yeah.
That that's what I'm always trying to do, is how do we create stuff to help people shorten the learning curve? And my biggest pet peeve in our space is how many people get taken advantage of by the tricksters out there. Because a physician coming in, not understanding business or marketing and not having the time will get sold a bill of goods of like, just give me 25 grand, I'll build you a course. I'm like, oh no, so trying to save people from that.
Cool. Well, okay. One final question, non-negotiable that you do on a regular basis, no matter where you are in the world, to optimize or continue to optimize your health or really focus on that, even when it's tough. When the tough gets going, what does JJ still do?
Sleep. Seriously, I'm so careful with prioritizing my sleep with time zone shifting. However, there's a couple other things. I travel with a coffee maker.
Oh, you do?
And drink Purity and Sacred Cups coffee. So I'm a total coffee snob and I always get my workouts in. But with sleep, I've been using those Oslo earbuds with an eye mask. So like no matter where I am, how crazy it is, I'm fine. Because just like you can be in the best place and all of a sudden you're like, there's a disco next door or whatever.
And they're that good. I've seen them. I haven't tried them.
They're amazing. They have saved me now so many times. Like
interesting.
Literally, you got to try them. They're incredible. Like Oslos, you can be in the loudest environment and you will not hear any of it. So Oslos have been a massive win. But exercise, like wherever we are, we always get our exercise in. We always get our sleep in. We eat healthy. We travel with all of that and our gazillion supplements, including now methylene blue. So I just added to the pile.
Supercharging. All right. Well, thank you, JJ, for being here. I really do appreciate your time, and I wish you a great rest of your day.
Thank you.
Thank you so much for tuning into another episode of the Health Optimization Medicine podcast. I hope you enjoyed this one with JJ Virgin. It was a really fun one to record. So much fun, actually. If you liked it, don't forget to like and subscribe below so you never miss an episode on your favorite platform. And we'll see you next time on the Health Optimization Medicine podcast.